Hello, I'm Dr. William E. Morgan, President of Parker University here in Dallas, Texas, speaking on behalf of Parker Performance Institute, our clinic in Frisco, Texas, located at the Dallas Star. Today we're going to talk a little bit about sports injuries and the increased amount of head injuries that we're having in youth sports, particularly women's soccer. Why women's soccer versus soccer in general? Well, it turns out that young men do a lot more upper body exercises, push-ups and pull-ups and weightlifting. And what that does is it creates more stability in the neck so their heads don't move as much when they head a ball. But women's soccer has had a great uptick in the number of concussions. And we want to draw attention to that. And what happens when a young person or even anybody hits the ball with their head, there's a trauma that goes through the brain. And the brain is consisted of gray matter and white matter, and they don't have the same consistency. So what happens when someone heads a ball, or God forbid, two people try to head the ball and they hit their heads together, there's a percussive force that goes through the brain. And as it goes through, you can see that the white matter and the gray matter do not move at the same speeds. So a shear force takes place. As we zoom in, you can see that there's nerves that cross between the gray matter and the white matter. And because there is this asynchronous motion, there's a shear force takes place and shearing occurs, causing tearing of those nerves. The tearing results in inflammation and cell death and disruption of normal nerve impulses. And what we've seen in advanced imagery on patients with head injuries who've had axonal injury like this is damage to normal connections. You see here normal connections throughout the brain, normal nerve impulses. Here, after someone's had a brain injury, there's disruption of what we would consider normal. Normal on the left, abnormal on the right. Some advanced imagery that we've seen at hospitals where we see normal impulses, broken connections after a brain injury, and the comparison of the two. We know now that the brain is plastic and with the right stimulation can heal. So what we've done is created an institute with a unique cadre of providers, nutritionists, strength and human performance experts, chiropractors, neurologists, nurse practitioners, and others, all working as a team to emphasize the healing of each of our patients. So if you or someone you know has had mild brain injury or concussion, please consider our experts at Parker Performance Institute.